Hey everybody, Dr. Holly here. Happy 5-Minute Friday. We're going to jump right into it today. What stats do I need to track? Now, if you've been through one of my trainings on numbers you need to know in chiropractic business, you probably know what I may or may not be talking about today and what I may or may not be a fan of. But I see this come up in conversation every single one of my discovery clients. When I get my new clients on board, I want to get a sense or a feel for how clear and how in touch those business owners, providers, etc. are, how in touch they are with the numbers in their business, okay? Because that's going to give me a clue about the mindset that moves forward on how do you pay yourself, how do you spend your time, etc. But I see this question a lot. I see this question a lot in Facebook groups. So thankful to my loyal fans who tag me in those posts, and so I can help to get the word out and provide this training to more and more people. But I think this is vitally important also if you're a student or if you're new in your career, maybe you don't own a business yet, and you're thinking, if there are any numbers that I should be keeping track of now, or how do I even set goals around certain things, etc. Let's look at this real quick. So what stats do you need to track? These are just baseline, okay? These numbers, you will see a lot of chiropractic management companies, coaches, etc. will look at these numbers. I'm going to tell you which one of these I'm actually a fan of and which ones I'm like, not so much. So what's your revenue? This is often called your collections, okay? All the money you bring in, all the cash you bring in, patients paying you, insurance companies paying you, whoever is paying you, we need to know how much actual cash is coming in. This is not the amount you're billing out and you're hoping that somebody's going to pay for it. This is not the amount that you have all those patient statements you've sent to your patients, you hope they pay them. This is how much cash is actually coming in your door, day in, day out, week over week, etc. Expenses, okay? We want to look at everything except for paying you, goes into the expenses. What does it take to just operate your practice? Okay, new patients, pretty simple. Established patients, again, those are your patients that are coming in for routine office visit care, and they get, some treatment fee for service in your office. A PVA is a number that's calculated. It's not a for sure given. I see this a lot where people are like comparing PVA to like a newer doctor to an older doctor in a practice or an associate or something like that. That's not comparing apples to apples, okay? So this number is going to move based on how many new patients you see, how many established or wellness patients that you see. And so it's variable, okay? It's hard to set goals around something that you can't control necessarily. And like I said, it can be a little bit subjective provider to provider. In the case lifetime, this is another one, some coaches use. I don't use it a whole lot, but essentially it's trying to come up with a number of like, if you could know how much a new patient was worth over time, like how much, revenue generation dollars can you assign to one new patient? And again, it's kind of important to see that number, but I think for the longevity of a practice or starting early in a practice, you're just not really going to have a good handle on what that number is, okay? So it's not going to be a good measure for you. So again, going through those again, I really want to know how effective are you at getting cash in the door, okay? And then how much money are you spending out just to have that door, okay? Just to have that door for people to come in. How much money are you spending going right back out before you get to pay yourself, okay? And then these two numbers, new patients and established patients, I like to have those and I like to add those up together because not every hour of your day is going to be spent on new patients. Not every hour of the day is going to be spent on established patients. I'm not saying you have to block off certain time for certain patients. Your workflow is your workflow, but I essentially want to see like how many patient visits are you seeing in a week or in a month, okay? So tell me, two numbers. What is your monthly revenue, which is the collections, that cash you're bringing in, and then how many patients are you seeing in that week or that month? And then that can get us to some really crucial stats or some numbers where we can start to kind of piece things together and set some goals about how you're moving forward in your business. So I apologize that my face is over this, but maybe I can move myself around. I didn't know that. So we're going to look at then, what is your revenue per visit average? So just taking that dollar amount, okay, and dividing it by those visits. And of course, this is going to be an average of those new patients and those established patients, okay, but we essentially want to come to some sort of an average because we want to compare that to the next line. What is your cost per visit? What is all of your expenses added up divided by each visit? And then in between is essentially your profit margin and then also where you get to pay yourself, okay? So the longer you're in business, we would hope to see that that's going to grow and it's going to help you make decisions about moving forward in your business. So that, of course, is my timer. I always like to talk too much. So essentially, that's going to get us to that point of like, what is that ratio of how much your overhead is versus how much that margin is for you to be able to take out for yourself? That's going to get us to that compensation ratio for you to know how much of the piece of pie you get to take home at the end of the day, right? So have a good weekend, everybody.